How are we doing? You all tired? Do you want me to stop here? Well, you're getting to the point that really I would like to be able to hopefully do just to my colleagues with all their hard work and really summarize why is it important to get an affinity that would allow you to really take your antibody to the clinic. So it's time to go to the clinic. Tighten your belt. We're going to Disneyland. What I'm going to be talking about is translation of information you have gained from early data, really combining affinity, preclinical data, efficacy information, safety information, and really how that translates into selecting your first in-human dose. Generally, for the course, this course that we have presented before, really we have a whole day, and we talk a lot about aspects such as toxicology or safety of antibodies, PK/PD, and this generally is the last item in the list because it really combines everything. But for a half-a-day course, really, it's very difficult. So you have to forgive me because a lot of this I'm going to flow through and really fly through and really not go to a lot of details on factors that impact pharmacokinetics. God really highlighted some important aspects on pharmacodynamics this morning. But if you have any specific questions regarding those, I can provide you with general references or I can really get into details. But for now, really, what I want to talk about is how we can facilitate effective information flow during development process. And one of the tools that you have is really bringing the pharmacokinetics, your exposure, to your pharmacodynamics, the effect that you see, whether it's deleterious or efficacious effect. And if you consider that, really, the common underlying goal throughout the development process is to deliver the most effective candidate into the market for effective treatment of the target population. And that implies cost, delivery, efficiency, safety, and potency. And if you think about it in depth, really, you understand that the common underlying denominator to achieve this goal is really the relationship between the unit dose and the unit effect. How much of this drug I need to give, how frequently I have to give it to achieve this endpoint and minimize toxicity. So what we really try to do is understand the relationship of these concentrations and the dose, and those being related to the concentration by pharmacokinetics and the effect, the beneficial effect and your toxic effect, and really understand this window, the therapeutic window that's there. In some instances, you have a very nice definition and separation. Sometimes these curves collapse. Sometimes these curves cross. And a lot of times, you get complexities such as hysteresis, that really there are time dependencies. And with antibodies, there's a lot of examples of that. And so it's not always easy, but the question becomes, is it possible to translate all this information to get to a point that we can understand a unit of this drug in mouse that results in this efficacy or toxicity, how that translates into what you anticipate in man? So again, highlighting that the drug